Namaste Vidya, Hamisha Khush Raho Vidya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series, we are discussing about the diseases of the locomotor system. In today's session, we are going to discuss about fibromyalgia. Till now, we have discussed various diseases related to the locomotor system like osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, and so on. In today's lecture, we are going to start with another important disease that is, although not that much common, but a lot of people are affected by that particular disease. So let's start with fibromyalgia. I believe you must all have gone through the books for the topics that we have covered. I have given the questions, the e-notes, the PPTs, everything for the portal, and it is already uploaded on the portal. So you should go to the portal, that is jvw.in, and you can see for this session in the teacher assignment. So let's start with fibromyalgia. What is fibromyalgia? Fibromyalgia is not a disease of the muscular system, but it is also related to the other systems. Other systems like digestive systems, fatigue, headache, muscle ache, stiffness, brain fat, pain, tenderness, etc. So what is fibromyalgia? Fibromyalgia is basically a common disorder that is characterized by chronic widespread musculoskeletal pain. So there is chronic widespread musculoskeletal pain with aching, with stiffness, with paresthesias. There is disturbed sleep, easy fatigability, multiple tender points. Fibromyalgia affects around 2% of the total population, and it is more common in women than in men, with a ratio of 9:1. So what is fibromyalgia? It is a very common disorder that is characterized by following things. It is characterized by chronic widespread musculoskeletal pain there is aching pain, there is great stiffness, there is paresthesias, there is disturbed sleep, easy fatigability, the patient becomes fatigued very easily, and there are multiple tender points. Fibromyalgia, it affects around 2% of the population, and it is more common in women than in men. So you are going to see different types of musculoskeletal pain. Aching pain will be there. There will be great stiffness of the joint. There will be paresthesias. Paresthesias means perverted sensations. There will be disturbed sleep. The patient will not be able to sleep properly. And there is easy fatigability. The patient becomes tired very easily. There are multiple tender points. Tender points are those points on which if you press, then there will be great pain experienced by the patient. It affects around 2% of the population, and it is more common in women, very much common in women as compared to men. Now, what are the symptoms of fibromyalgia? Fibromyalgia basically affects a lot of systems, and depending upon the system affected, the symptoms are present. I have given you a picture and giving all the symptoms of fibromyalgia in a summarized way. The PPT, the picture is already present in on the portal in the presentation. So the symptoms, I'm discussing from the quick summary. The symptoms of fibromyalgia, when it is affecting the central nervous system, it is responsible for chronic headache. There are different types of sleep disorders. There is dizziness with cognitive impairment. Cognitive impairment means you are not able to recognize different people. There is memory impairment, anxiety. There is great variety of anxiety and depression. The patient remains depressed because of the constant ongoing pain. There is also muscular pain that is known as musculofacial pain with fatigue and twitches. There are various urinary problems, that is the problems while urinating. In the reproductive system, the severe pain are related with dysmenorrhea. In the eyes, there are different types of vision problems. The joints of the jaw, that is dysfunction, is present. In skin, there are various complaints. There are chest pain. In the stomach, the patient complains of nausea. There is joint stiffness, joints complain with the morning stiffness, and systemic complaints which have pain, weight gain, and cold symptoms. So what are the common symptoms? The common symptoms that are given in the pictorial form are related to central nervous system, muscular system, the urinary system, eyes, joints of the jaw, the skin, chest region, stomach, joints, and systemic regions. Now, clinical manifestations. So how does the patient present to you? Whenever a patient of fibromyalgia is coming to us, how does he present to us? So the clinical manifestations consist of pain present all over the body. So the patient will present with pain that is present all over the body, both above and below the waist, on both sides of the body, and involves axial skeleton. So there is pain that is present all over the body, and it involves the axial skeleton, the neck, back, and chest. The pain is attributed to fibromyalgia is poorly localized. So the patient may not be able to localize the pain properly and diffuse and ignore. There is severe, it is severe in intensity and is associated with reduced functional capacity. So the functional capacity is reduced. And for the diagnosis, pain should be present on most of the days for at least 3 months. So for the diagnosis of this disease condition, the pain should be present for at least 3 months in an individual. Now, in the occiput, there are certain tender points. As I have talked earlier in this lecture, there are certain tender points on which you feel a lot of pain. So when you press these points, they feel very sore. So tender points are located at various spots. That is on the occiput, on the trapezius, supraspinatus, in the gluteal region, in the greater trochanter, low cervical region, second rib, lateral epicondyle, and on the knee. So in the occiput, these all are the tender points. Tender points mean if you press on these points, the patient will be very painful. The condition will be very, very painful and the point will be sore. So in the occipital region, there is suboccipital muscle insertion. At that point, the pain is felt. In the trapezius, there is midpoint of the above border. On the supraspinatus, the pain is felt above the medial border of the scapular spine. In the gluteal region, there is upper outer quadrant of the buttocks. On the greater trochanter, it is posterior to the trochanteric prominence. In the low cervical region, it is anterior aspect of the inner transverse spaces of C5 to C7. There is second rib, second costochondral junctions. There is lateral epicondyle, 2 cm distal to the epicondyles. And in the knee, it is medial fat pad proximal to the joint line. Now we come to the symptoms, the symptoms of fibromyalgia. So there are various neuropsychological symptoms. Neuropsychological symptoms includes the fatigue. There is stiffness. There is sleep disturbances, cognitive dysfunctions, anxiety, and depression. So in the neuropsychological symptoms, we have fatigue, we have stiffness, sleep disturbances, cognitive dysfunctions, anxiety, and depression. There is fatigue. Fatigue is highly prevalent, and the pain, stiffness, and fatigue are often worsened by exercise. So there is neurological symptoms of fatigue, stiffness, sleep disturbances, and cognitive dysfunctions with anxiety and depression. Fatigue is highly prevalent in case of fibromyalgia. There is pain, stiffness, and fatigue that is often worse by exercise. The sleep complaints include difficulty in falling asleep, difficulty in staying asleep, and early morning awakening. There are symptoms of anxiety and depression that are common. Because of the pain, there is great pain and anxiety. The patient also complains of headache with a facial or jaw pain. So there is facial or jaw pain. There is regional myofascial pain that is particularly involving the neck or back and arthritis. There is visceral pain that is involving the gastrointestinal tract. There is bladder and pelvic or perineal region is often present. There is also a comorbid condition with a chronic musculoskeletal infectious, metabolic or psychiatric conditions. Comorbid condition means those conditions which are appearing or associated with the fibromyalgia. So the comorbid conditions include chronic musculoskeletal infections, metabolic or psychiatric conditions. There are also psychosocial considerations. The symptoms of fibromyalgia have their onset and are exacerbated during the periods of high level, reveal or perceived stress. There are also functional impairment of the physical, mental, or social domains. So these were the symptoms of the fibromyalgia. Now we come to the differential diagnosis. Differential diagnosis are the conditions which resembles fibromyalgia. So the differential diagnosis, the musculoskeletal pain is a common complaint, and differential diagnosis of fibromyalgia is very broad. It resembles various inflammatory conditions. The conditions of inflammation include rheumatoid arthritis, spondyloarthritis, systemic lupus erythematosus, and Sjogren's syndrome. There are various infectious conditions like hepatitis C, HIV infection, and Lyme's disease, which resembles fibromyalgia. The disorders of the endocrine system includes hypo or hyperthyroidism and hyperparathyroidism, which resembles fibromyalgia. Various psychiatric diseases like major depressive disorder also resembles fibromyalgia. So fibromyalgia is seen with various conditions like inflammatory condition, infectious condition, endocrine, and psychiatric disease. In the inflammatory condition, we had rheumatoid arthritis, spondyloarthritis, systemic lupus erythematosus, and Sjogren's syndrome. In the infectious disease, we had hepatitis C, HIV infection, Lyme's disease. On the endocrine system, we had hypo or hyperthyroidism, hyperparathyroidism, and psychiatric diseases with a major depressive disorder. Now, what are the various lab investigations that could be done in the case of fibromyalgia? Lab investigation includes routine investigation like ESR or erythrocyte sedimentation rate with C-reactive protein, blood CBC, complete blood count, so we have to go for complete blood count and thyroid stimulating hormone. So in the routine investigation, we have to check for erythrocyte sedimentation rate, ESR, or the C-reactive protein, complete blood count, CBC, thyroid stimulating hormone, that is TSH. It is guided by history and physical examination. In the physical examination, we have to check for complete metabolic panel, anti-nuclear antibody, anti-SSA, that is anti-Sjogren's syndrome A and anti-SSP, rheumatoid factor and anti-cyclic cytolytic peptide, that is anti-CCP antibodies, creatinine phosphokinase CPK, viral and bacterial serologies, and spine and joint radiographs. Now, what is the treatment for fibromyalgia? For the treatment of fibromyalgia, we have to understand the symptoms first. Explaining the genetic triggers and the physiology of fibromyalgia is very important. The education regarding expectation for the treatment, the focus on improved function and the quality of life rather than elimination of the pain. Pregabalin, duloxetine, and milnacipran have shown benefit for fibromyalgia. Tricyclics for sleep disorders and antidepressant for anxiolytics. So in the treatment, we have to first of all understand the problem, the symptoms of fibromyalgia. Then we have to explain the genetics, the triggers, and fibromyalgia and physiology of fibromyalgia. Education regarding the expectation for treatment, the focus on improved function and quality of life rather than the elimination of the pain. Pregabalin, duloxetine, and milnacipran have shown benefit for fibromyalgia, and tricyclic for sleep disorders, antidepressant, and anxiolytics. So in fibromyalgia, the summary consists of anxiety. Let us first revise, and then we will discuss the homeopathic medicines. So in fibromyalgia, it is a common disorder that is characterized by widespread musculoskeletal pain, aching, stiffness, paresthesias, and disturbed sleep, easy fatigability, multiple tender points, and it affects 2% of the total population with female is to male ratio 9:1. Symptoms include chronic headache, sleep disorders, dizziness, cognitive impairment, memory impairment, anxiety, depression, myofascial pain, fatigue, twitches, problems urinating, dysmenorrhea, vision problems, pain, weight gain, cold symptoms, dysfunctions of the jaw, skin complaints, chest pain, stomach nausea, and joint pains with morning stiffness, dysmenorrhea. The pain is present all over the body, and it is both above the waist and below the waist, and involves the axial scalp. The pain is attributed as poorly localized, difficult to ignore, and severe and in intensity and associated with reduced functional capacity. For diagnosis of fibromyalgia, pain has to be present for at least 3 months. There are various tender points on which the pain is usually felt, that is present on the occiput, the trapezius, the supraspinatus, gluteal region, greater trochanter, low cervical region, second rib, lateral epicondyle, and the knee. There are various neuropsychological symptoms like fatigue, stiffness, sleep disturbances, cognitive dysfunction, anxiety and depression. With a fatigue that is highly prevalent, there is pain, stiffness, and fatigue, often worse by exercise. The sleep complaints includes difficulty in falling asleep, difficulty in staying asleep, early morning awakening. The symptoms of anxiety and depression are very common. There are headaches, facial or jaw pains with regional myofascial pain. Comorbid conditions include chronic musculoskeletal infections, metabolic and psychiatric conditions. Psychosocial consideration consists of symptoms of fibromyalgia that have their onset and are exacerbated during the periods of high-level real or perceived stress. Functional impairment consists of physical, mental, and social domains. The differential diagnosis consists of various diseases that resembles fibromyalgia. It includes inflammatory conditions like rheumatoid arthritis, spondyloarthritis, systemic lupus erythematosus, Sjogren's syndrome, infectious hepatitis C, HIV infection, Lyme's disease, endocrinal disease like hypo and hyperthyroidism, hyperparathyroidism, and psychiatric diseases like major depressive disorders. Lab investigation consists of routine investigation like ESR, erythrocyte sedimentation rate, and CRP. Complete blood count, the thyroid stimulating hormone is checked for. It is guided by the history and physical examination with complete metabolic panel, anti-nuclear antibodies, anti-SSA, anti-Sjogren's syndrome, and anti-SSP, rheumatoid factor and anti-cyclic cyclinated protein, anti-CCP, creatine phosphokinase, and viral and bacterial serologies with spine and joint radiographs. The treatment of fibromyalgia consists of understanding the symptoms, explaining the genetics, triggers, and physiology of fibromyalgia, education regarding expectation for the treatment, the focus on improved function, pregabalin, duloxetine, and milnacipran, tricyclic for sleep disorders, and antidepressant for anxieties. There are various homeopathic medicines for fibromyalgia, which provides wonderful relief. For anxiety and depression, we provide Ignatia. For memory impairment, we give Ignatia. Sleep disorders, we can give Coffea. For the jaw pain, Gastox. Myofascial pain, we can give Synphytin. Nausea and irritable bowel syndrome, we can give arsenic or Ipecac. For weight gain, we can give Graphitis. For restless leg syndrome, we give Rastox. For fatigue and dizziness, Oromnet. For chronic headache, we can give Sepia. For vision problems, Ruta. Multiple chemical sensitivities with Calcarea carb. Chest pain, we can give Cretigus. For reproductive system disorders, we can give CPR Calcarea carb. For urinary tract infections, we can give Cantharis. For joint pain, we can give Rastox. So these are the common indicated medicine that can be given in case of fibromyalgia. So this was all about fibromyalgia. In the next lecture, we are going to discuss about osteoporosis. I hope you have understood the session properly. If you have any query, please mention in the comment box and I'll try to resolve it. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. In the next lecture, we will be studying osteoporosis. Thank you very much.